Hey, my name's Jonah, and I'm just gonna talk super fast about like the larynx and all the different parts of it and kind of what it does on like a super not specific way. So it's made up of, at least on this model, we got just showing three different cartilages, right? We got the thyroid cartilage, got the cricoid cartilage, which is like all of this. Thyroid's all of this, and you got like the arytenoid cartilages, which are these two things that are kind of in there. And they can kind of move either like this with the thyroid and the cricoid, or the arytenoids can move. So the arytenoids are connected to the vocal folds, and they're involved in like the, I guess, the tensing and the laxening of those, and that is done through the cricoarytenoid joint, which affects like the vocal folds and how tense they are. And then the other main like movement between the cartilages is the happens at the cricothyroid joint, which is the point between the cricoid and the thyroid cartilage, and that kind of innervates it like this and allows the or doesn't innervate it. It allows the thyroid to move up and down. So there are a few different muscles involved in this. So in terms of the like vocal folds and that area, you got the lateral cricoarytenoid, yeah, or the sorry, yeah, the lateral cricoarytenoid, which is involved in like closing the vocal folds when they're open or adducting them. You got the posterior cricoarytenoid muscle, which is involved in opening them or abducting them. And you got the transverse and oblique arytenoid muscles, which are also involved in the adduction of the vocal folds or the closing. And all of this is like innervated by the recurrent laryngeal nerve. And if this gets kind of messed up, like if this stops sending signals to the muscles, it can either like stop one of the vocal folds from moving, which affects your vocal quality by making it either like kind of breathy because they're not fully closing, or makes it sound kind of like hoarse and rough because they're not fully opening, or just some combination of that. Or it can cause like both vocal folds to not be able to move, and then you obviously can't phonate. And also, if you get unlucky, then they can block your airway and stop you from breathing. And then the other big muscle in the larynx, at least in terms of this model, is the cricothyroid muscle, which is gonna again allow you to move the arytenoids and the thyroid and help you like tense and lax your vocal folds. So like if you want to do higher pitched, if you want to do lower pitched, that kind of thing, that's controlled by that muscle, and that is innervated by the superior laryngeal nerve. So that's kind of everything that has to do with this model. Also, I forgot to mention it. It's dynamic lattice. So yeah, thanks for watching.